Okay, everyone. Thanks again for coming to our regenerative medicine seminar. This is for September of 2024. I'm going to share a screen with you here and we'll get going. And just one second here. All right, I'm going to have to come back here. All right, let's try that again. Okay, here we go. All right. Once again, this is Dr. Richard Kim, and this is our regenerative medicine seminar for September of 2024. Two things to remember. The first is that you should turn your volume up. And then secondly, of course, is to click the Q&A if you have questions, and I'll save the answering of questions at the very end. And of course, this is all about pain and exactly how stem cells go about solving that pain. We'll start off with the first Q&A here from Naima A, area code 718. Questions: stem cell and pain, stem cell for regenerative therapy, stem cell and arthritis, the pros, the cons of stem cells, who is not a candidate for stem cell, how is it different than PRP, what is the cost of PRP and stem cell, and do patient need referral? So in a nutshell, Naima, that is everything that we're going to go over. We're going to talk about what it is, how well it works, what do we do it for, what do we not do it for, who is a candidate, who isn't, and what the differences are. And of course, to answer the question of a patient needing a referral, a patient does not need referral. Christy B asked from area code 315, overview and basic understanding of the treatment. So the major takeaways for you here, Christy, is that number one, we're non-surgical. Number two, there's no medication. And then lastly, that this is something that does last years. Okay. The common goals are very similar for all of us. We, including as the medical pro physicians for you, want the same things. We want to avoid surgery for you. We want to stop medications. We want an increased quality of life. But of course, when we come to these common goals, how do we ensure that? We all want a plan, and we want that plan to be safe. We want to have low risk, short recovery, and of course, avoid any pitfalls. Here's a familiar example. We have a retired psychologist who flies airplanes for a hobby, also a runner, is competitive, and also does it for stress relief. However, the back pain ended his running. No more competition, no more fun, no more stress relief, limited his flying time. So really sort of impacting his retired life here. The chef is next. It really enjoyed spending time with the family, was in constant motion, moving heavy restaurant equipment all the time. This was affecting his work. This is made for difficult work days. To the point where he contemplated changing careers. In general, our traditional treatments are missing the target. They have limits. And the first is with surgery, we have an issue that is permanent, it's invasive, requires a long recovery. Secondarily, we have medications. Steroids are often a band-aid, and with these band-aids, they weaken and they damage tissue. Sometimes we have to repeat the steroids, which eventually means repeat weakening and repeat damage. Over-the-counter medications can lessen the symptoms, certainly, but the effect wears off, and then we have to go back to repeating that dosage. 2 months after stem cell therapy, our psychologist was returned to running, ran the 4th of July 4-mile race, a 13-minute pace. Confidence to train for a half marathon with his grandson. Chef was back at work full time, able to provide for his family, so an important thing. But for us, how do we do this? We're breaking the cycle. Pain leads to degeneration, and degeneration leads to further pain, and then around and around we go. So what we're really trying to do is end this pain and degeneration cycle. We're all about the third solution here. So not surgery, not medication, something else. For us, we have a high, we're happy. We have a high degree of success rate. We have a process that gives you years of relief. And of course, we have guaranteed acceptance. Your therapy um, comes from you and goes back into you, and therefore it's guaranteed. But what exactly is regenerative medicine? So it's a new field of medicine, and the goal here is to restore and not to replace tissues. We're taking damaged tissue, transforming them into healthy and functional tissue. Different materials typically are used to restore this health, including number one, platelet-rich plasma, and next, stem cells. So platelet-rich plasmas are great for the green and yellow circle, which are sort of the small to medium-sized problems, and then stem cells are generally reserved for medium to medium large size problems. Here's a great example of where cells are attacking the areas of badness. So if the red is bad and the green is good, you can see the cells migrating from one area into another in order to achieve that attack of area. And of course, that red area is what's responsible for the pain, the stiffness, the sciatica, and the nerve pain, the neuropathy, the shooting, the aching, grab type symptoms. This is my Pac-Man analogy, and I like to put this analogy towards you because I think we can all understand and relate to Pac-Man. But basically, this is where the pellets are inflammation, and Pac-Man eats those pellets one at a time. So if you can imagine PRP, that's what PRP is like, but many Pac-Man eating many pellets all at the same time, that's more what like stem cells are. And the goal here isn't so much to beat the level, but it's to beat the problem and leave the game entirely. And we're talking about something that can last anywhere from 5 to 10 years. Where exactly do the stem cells come from? Well, they come from the posterior of the pelvis here, and we're injecting them into various locations, including the discs of the spine in this example. For us in particular, this is how we do it. This is our typical schedule. So initially, we always want to start off with a consultation so we can learn about you, your activities of daily living, what's limiting you, and how we can best solve this problem for you. We typically like an MRI sometime thereafter. Then we start off with the first platelet-rich plasma. Then followed up with the second platelet-rich plasma, which is then where the stem cells get involved. And then finally, somewhere after that, the third platelet-rich plasma. And then, of course, we want to rebuild with physical therapy, chiropractic care, general exercise, and so on. So what are the sort of things that we're treating? In particular, we treat a lot of neck and back issues. So stenosis, arthritis, degenerative disc, sciatica are things that you're going to hear about and things that we treat. So lower body pains are also something that we often treat in terms of joints and ligaments and tendons. So arthritis, bursitis, meniscus damage of the knee, Achilles tendon, very typical for us. Upper body also similar, rotator cuff, which are tendons in your shoulder, arthritis of the shoulder, tennis elbow, carpal tunnel. But we always get the question, am I a candidate? And what we typically like to describe it as is if it's an injectable area or an operable area, we can also treat it with stem cells. It's important to note that for us, starting with the diagnosis is such a pivotal beginning point. Once we have an accurate diagnosis, we're talking about an accurate location that we can then place the accurate therapy. And of course, for us, all our therapies always include an MRI as part of our process. Next slide here. What if you've even had surgery? Can you still do this? And the answer is yes. But of course, we require a consultation to start so we understand you and understand what you're attempting to achieve. It's important to get that diagnosis, get the imaging, and of course, the history and exam is critical to having us learn about you and learning about your body and what's causing you the pain. Types of surgery can still be helped. The types of surgery are arthroscopy, fusion, rotator cuff surgery, and oftentimes people may come to us with post knee replacements and hip replacements, and that can present some significant limitations. But we still like to have that conversation with patients during that initial consultation. Some frequently asked questions that we get: where will my stem cells come from? And stem cells are 100% of the time in our office. And until things change with regulations, they come from you and they go back into you. Next question of how long before I can become active. So uh, for us, at the end of the third injection or at the end of the 6 week mark is when you're becoming active again. Next question of when do I feel the benefits? So benefits can be felt as early as between the second and third injection. Next question of how long will the tissue stay repaired? And then tissues can stay repaired for anywhere from 5 to 10 years. And so that really sometimes varies and it depends on what we're treating. And the last question, of course, how well does this work? And it really varies from what we're treating and the person, but in general, we're talking about something that helps the majority of people stay away from surgery for a good number of years. And the big thing here is that we want to get you back active again, and that's what we've been able to achieve. Kim C, so we'll go into the questions and answers here. So Kim C from area code 315 asks about L4 and L5, degenerative disc issues. So degenerative disc here is where the jelly is leaving the donut slowly. And that's our example of what the disc is in our spine. Stenosis, you can see in the large highlighted circle there, is where the blue is approaching the yellow, which is the nerve. And so stenosis means that as that tunnel closes, that blue disc is then pushing into the nerve and then creating a smaller tunnel. For us, stem cells really means keeping the jelly within the donut versus something like surgery, where it's more about scraping the the jelly out of away from the donut, and then that's the extent of it. William B. in area code 585 asks about a torn disc. For us, when we're talking about a torn disc, we're typically talking about an annular tear. Stem cell therapies work great for this. And we have a few examples of before and after MRI findings where we've had people with complete resolution of these annular tears. So it's something that we treat quite often and see pretty frequently here. Tina M from area code 518 said, is stem cell therapy available for hip arthritis? So the answer is yes. So we do treat knees, hips, knees, shoulders, and this is what we call the large joints. For us, it's important to have that initial consultation to help us understand your severity and, of course, what we're trying to achieve with it. Deb L from area code 978 said, lower back pain for me all the time. Stabbing pain comes and goes. Could be for sciatic or psychotic pain. Been to many chiropractors, watched many videos, and tired of the pain. And we get it. We understand pain. We have pain. So sciatic or what you term psychotic pain is something for us treated. But it sounds like you've tried different methods. The chiropractor, you probably have tried the medications and other alternatives. For us, regenerative medicine is definitely that minimally invasive alternative. It's not a surgery, it's not a medication, and really helps you get back to living your life once more. Lisa S. from area code 518 says, I got told I need surgery for me, L4, S5. Don't have time or the money to do this. So sure, we can understand that having surgery can certainly take you out of your life and your lifestyle for quite some time. Surgery, specifically lumbar fusion, means not allowing two bones to move, and that could be forever. So disc above and below are forced to increase the flexibility. This becomes a fusion in a lot of patients, which can lead to something called adjacent segmental disease. That's where the disc above and below, even though they're increased flexibility, are then breaking down more, or more quickly, I should say. So surgery, for Lisa, in your case, we understand can lead to a long recovery and take you out of work for quite a while. And on top of which may lead to another surgery down the line. The recovery for our process is significantly shorter, significantly quicker than surgery and back to work. Oh, I would in generally say somewhere around 2 weeks' time. Glenda H. from area code 518 asks about riding sciatica, lower back pain, numbness, and cramps down the leg. So for you, Glenda, I'd say keep watching. We've got some slides talking about sciatica, and I'll get to those soon here. So Neil J said from area code 518, lumbar laminectomy surgery for spinal stenosis with L405, fusion in 2019. Although relieved some of the symptoms, left with chronic pain and never fully eliminated. Over the past few years, number of steroid injections and chiropractic sessions, providing some temporary relief, but still experiencing pain, daily limiting everyday ability and activities. So pain after fusion often is meaning, more surgeries in sort of the traditional pathway of treating back pain. We've helped many people in similar situations, and again, similar to what we talked about before, adjacent segmental diseases where the disc above and the disc below start to break down. Ethel G from area code 518 said, will insurance cover treatments? Can the treatments help post-knee replacement pain? Insurance, unfortunately, does not cover these therapies, and we're hoping for that'll change at some point in time. But if you're post-knee replacement, I certainly recommend the consultation. We'd certainly like to explore the possibility of back pain for some people who are continuing to have knee pain after replacement. Area code 914, Robert F. asks about studies or data that support our specific treatment protocol, stating torn meniscus along with moderate to severe arthritis. So for us, meniscus is a pretty common diagnosis that we treat. But to answer your question, both yes and no. Yes, for the growing number of studies supporting regenerative medicine for meniscus tears. No, for a specific protocol. Our protocol was very much developed and individualized over our 10 years of experience. And so really comes from our, and specifically my experience with this over time. Michael M. from area code 518 said, do you have the equipment for the procedure in Skinny Atlas? If not, will in the future before February. So for our therapies, we for some of our outer offices, we do partial process in some of the outer offices, and we do partial of the series of injection here in Saratoga. So unfortunately, not yet, and unlikely before September there, Mike. Colin T from 973 says, how to use diet if possible to regain or to maintain good joint health. So we do have a registered dietitian on staff who has been pivotal for us in terms of recommending regenerative medicine specific dietary recommendations. So a consultation with her is of course possible. Simply call the office and establish that. George T from 514 asks about hip osteoarthritis. Yes, again, to the hip question. For us, stem cell therapy applies to hips, knees, and shoulders, which we consider the large joints, and of course, the low back and the neck, which we consider spine. And then the small joints are the wrist, elbow, and feet. So, yes. Judy C says, I need a total hip replacement, bone on bone, and also both knees. Bone on bone, I have terrible sciatic in the groin, buttocks going down the leg. So we often find that a lot of people are utilizing the words bone on bone a little bit liberally and generously. And we often see people who have been told to bone on bone, but they come into the office and of course that's not the case. So it's really important for us to have that conversation, talk about what your limitations are. So even if you are bone on bone, exactly how much pain are you having? Exactly what are your limitations? We have to remember that we have to treat patients and not pictures. For us, stem cell therapy applies to both joints and sciatic-based pains, different processes. We like to have a typical approach for people who are having this combination of both back and somewhere else, to focus on the spine first. That really helps us with your core development, and then, of course, uh, helping you get better ultimately. Barbara and P from area code 585 says, how to control the pain, stop the progression of the spinal stenosis and arthritis, potentially reversing the degenerative disc disease. And for us, we think about the tunnel, as you can see in the background here, as the nerve running through the tunnel, and the disc holds that tunnel open. The degenerating disc means a collapsing tunnel. Regenerative medicine is the means of helping keep that tunnel open. So if we can help keep that tunnel open, we're going to help you keep that space in your disc and your nerves free from irritation and pain. Cindy A from 518 said, I've been living with degenerative disc, ankylosing spinal stenosis. I think you meant the ankylosing. So stem cells certainly help restore the disc quality. That's what we've seen in our office, and the literature has certainly proved that. And our goal is, even though you have degenerative disc and ankylosing spinal stenosis, is to relieve that pain from that stenosis. And we're talking about something that can, again, last 6 to 10 years. Maria TS from area code 514, info on stenosis of the spine, please. So again, we're talking about the canal and the nerve running through the canal of the spine. And of course, the stenosis is when the canal narrows. Nerves are then irritated because of this narrowing. And this can be narrowed by, or the irritation can come from the disc, the scarring, a number of issues in the spine. For us, having that consultation and getting in contact with you and reviewing this all together with you is a really important first step. Linnea M said from 315, the amount of blood needed to process. So for platelet-rich plasma, blood can be really separated into several layers. So we'll just call them A, B, and C, for example. If a layer B is then isolated, we can use that material to inject. Total amount of blood is anywhere from 60 to 120. And depending what we are injecting and the patient health, it can vary. So I would say anywhere from 60 to 120 milliliters. Colleen from 315 said, how can I get rid of my back pain without any more surgeries? So regenerative medicine is that emerging field where you can get rid of back pain without any more surgeries. We've seen great degrees of success for people without surgery or more medications. What we like about this in specifically is that it's 100% of the materials that come from your own body and then end up going back into you. We also enjoy the fact that it's outpatient. You walk in, you get done, and then you walk out. No hospitals, no long hospitalizations and hospital stays. And so there's obviously an ease to that. Todd A from area code 315 says, see if we could help my wife with her back pain. So back pain is a common successful treatment problem. But first, for us, we always like to understand why she's having that back pain. So I'm going to push you towards that consultation again and then establishing with us. Henry R from 315 asks about backache with nerve pain. So when is backache not just backache, when there's nerve pain, and we want to understand for you, the level of time and nerve damage you've had. So the longer you've had nerve damage, the harder it is for recovery. So that's important for us to know. John S. from 518 said relief from bulging and herniated discs at L405 and sciatica. So we're talking about radiculopathy when you're having pain down that sciatic pathway, and this combination of highlighted circles shows nerves that connect together to become one major channel, that thick red piece. And when we have that thick red piece, that's that's what the sciatic nerve. But you can see where if you have degenerative disc and irritation of the nerve higher or irritation of the nerve lower, you can still have the similar feeling and the same symptoms, even as they descend down your body. We're talking about a history of symptoms and exam, which we want to obtain from you during our initial consultation. So that first conversation is just so important for us. Diane L, again, talking about sciatica. Again, the highlighting circle showing you. So the sciatic nerve specifically is responsible for the muscles in the legs and through the body, including your glutes. It's not just the nerve sensations, but also control of the muscles. These nerves, like I was saying before, are simply wires that run from your spinal cord and goes all the way down to your feet and every muscle in between. So everything you feel on the backside of the leg there is often controlled by the sciatic nerve. And of course, we want to know, where is that nerve pinched? Is it pinched higher up in the process or lower down? And is that are we then talking about temporary or is it permanent damage? Yvette S. From area code 267, daily pain and stiffness. So for us, we really need to have that first step where we meet you and help you figure out a diagnosis. Then we want to understand the severity of the diagnosis. And it's not just pictures, but it's about what you can do, what you can't do, how you're limited. And then only then can we understand the different options for you and your treatment. Leonel R. from area code 518 said, I'd like to know if I'm a candidate for stem cells. So that's a great question. The good thing is that the majority of people are candidates. But for you specifically, we'd like to have that consultation to discuss and figure out what your limitations are and if in fact you'd be a good or a great or not so great candidate for stem cells. John T. from 514 asked about osteoarthritis in the knees and general joint pain. Knees and the spine tend to be the most common treatment areas for us. General joint pain, we want to know what exactly do you mean by that? Which joints? Is this something where there's a systemic issue or not? For us, we want to individualize those therapies, focus on the specific hip or focus on the specific ankle. Precision and accuracy are all part of it. Unfortunately, regenerative medicine doesn't just sort of blanket cover everything in our bodies. Mark A asked from area code 607, does insurance cover it and how often does it need to be done? So insurance, unfortunately, does not offer coverage for these types of services. The good news is that these therapies can last years. And I previously have said anywhere from 6 to 10 years, but sometimes we discuss 5 to 10 years. And the discrepancy really comes from what are we treating. Spines and knees are slightly different. The process is different. And so the longevity of these therapies are a little bit different as well. Okay, so we're at our last slide here, and this is our offer to you guys for being in a webinar attendee and viewing this, listening to me from beginning to end. If you're willing to call by Friday at noon, we are happy to offer you a free consultation. Just please mention the webinars. And of course, you'd have to have your consult scheduled at that phone call. Doesn't have to be seen by Friday, but just if you call simply is good enough. Our next webinar is on October 23rd, and some contact information for you. Our phone number is 518-871-9900. And for our northern folks, 514-697-8919. RichardKimMedicine.com is our webpage. RichardKimMedicine.com/webinars is where prior and future webinars can be viewed. And then /MRI for those who are interested in obtaining your own MRI. Okay. So that is the end of that. I will hang out for a minute for anybody who has questions. Happy to answer. Okay, no questions. So happy to chat with you guys and have you guys attend. Hope to see you in October. Please pass the word. Thanks, you guys.